Hi, my name is Dr. Avi Patel. Today in this video, I'm going to be talking to you about the pros and cons of corporate dentistry, as well as posing the question of, is corporate dentistry for you? I will say this now. The things that I say in this video do not apply to all of the DSOs. Each DSO operates differently, so you have to do your research before you even get involved with any of them. All right, so what is corporate dentistry? Corporate dentistry is known as a DSO, or a dental support organization. A DSO is an independent business support center that contracts with dental practices. They provide business management support as well as non-clinical operational support. You will find that DSOs usually own multiple offices, anywhere from 5 to a couple hundred. With DSOs, whenever you have a scaled operation like this, the first thing that usually falls off is patient care. The quality of patient care in many DSOs are not going to be the same as if it were a private practice. The reason is because when you have such a scaled operation, it's very hard to get a quality control system in place. DSOs come up with processes that they feel can be utilized in all of the offices the same way. This, as you can see, is a pain point. For example, let's say you as a dentist wants to operate a new procedure in the office. You would come to the table with a process and way that you would go about implementing it, but if that does not align with the way that the DSO would like for you to operate, this can be a problem. The DSO will default to their ways and their preferences, and this will cause friction between the dentist and the DSO. Another con is contracts. DSOs have very rigid and strict contracts that they aren't willing to negotiate on. This can also be a problem. One of the biggest things can be notice periods. They can be anywhere from 30 to 120 days. This is a long time. They can also have things like no notices for termination, restrictive covenants that have a large mile radius, anywhere from 10 to 20, and a bunch of others. Now for the positives. So there's always going to be cons to things that you look at, but with DSOs, I will say that there are a lot of positive things that can come of it. First off, most of them are offering CE stipends, anywhere from $1,500 to $2,500 a year that you can use on continuing education. Many of them also have in-house continuing education that they offer to their dentists. This is super useful. A DSO that I worked with offered implant training, totally paid for. I used it, and then I started doing implants. It was awesome. DSOs will also offer things like paying for your health insurance, doing a 401k with you, paying for malpractice insurance. With DSOs, you'll also tend to have a bigger patient pool to work with because they do accept a lot of insurances. You'll also find that with DSOs, they'll have lower lab bills because they're able to leverage a high volume number of cases going to particular labs. So this is a massive benefit. You'll also find that you'll have a lot more flexibility when it comes to taking time off because DSOs will usually have multiple doctors in the office. So you'll always have someone to be able to look after your patients for you. Another thing that I love about DSOs is they usually have in-house specialists. This is a great thing when it comes to patient care. DSOs also have bigger budgets to spend on instruments and materials. You may even find some mentorship opportunities within the DSO because there are so many doctors in that network. In that network, it becomes a community where you are able to talk to as many doctors as you'd like. So, is the DSO right for you? Honestly, it just depends on what you are looking for in your career right now and where you want to go. If you're early in your career and you're looking for structure, stability, and you just want to grow as a clinician and focus on dentistry, a DSO could really help you. If you really care about processes, procedures, protocols, and everything, and you want to be able to have a lot of control over that, DSO is probably not going to be the place for you. If you still have questions about DSOs, don't hesitate to reach out to me. I'd be more than willing to give you my insight. If you enjoyed this video, please drill that like and subscribe button and share it to anyone else that you think it may help. Have a great day.